ladies and gentlemen. Our group met in the beginning of the International Creative Europe project BR, led by Radio Slovenia, and decided to propose this Brain and Music Symposium and research the situation in Slovenia on introducing music into Slovenian health system. Anna and Mansa, please, the floor is yours.
Thank you. So music has been established as a multisensory tool that can be used in healthcare, can be used as a tool for relaxation, enrichment of everyday life, connecting with others and oneself, encouraging movement, improving agency, inducing moods, providing access to emotional content, and improving cognitive functions. And despite these established effects, it's not widely used in healthcare practices in Slovenia. So we aim to gain insight into the extent to which music is already used and what obstacles prevent it from being more widely used. The ultimate goal of our project is to sensitize the medical community and the general public to consider music as a relevant agent in Slovenian healthcare. This needs to be done with the awareness of the current susceptibility of healthcare workers to such interventions, which is why we implemented a pilot study where we administered a short online survey to musically active medical doctors. The questionnaire included questions about the existing use of music and potentials for future implementation, such as where and under which conditions would the interventions be most welcome, what are the foreseeable obstacles, do they sense the need for research in the area. We wanted to assess whether this form of questionnaire will yield valuable information before administering the questionnaire to a larger sample. So the questionnaire was first distributed via personal contacts and answers were anonymized. We received responses from 16 musically active medical doctors. With a small sample size, we gained insight into the practical aspects of the questionnaire, but we were also able to detect some preliminary patterns that would be more rigorously tested in the larger study that Anna will talk about later. For example, the physicians that we surveyed believed that the most feasible introductions of music would be in a more passive form, like in a waiting room or during the preparation of a patient for a medical procedure. And 6 of the physicians were already using music in at least one of the settings. However, many ideas about the possible future introductions of music in healthcare settings are met with doubt about feasibility of implementation of such interventions, mostly due to problems with technical equipment, music selection, and work overload. The physicians also frequently mentioned the diversity of personal preferences of the users as an important challenge while implementing music, which is really an important consideration for musical interventions. Markedly, all of the participants believed that systematic education among healthcare workers about the possible benefits of music would be necessary. The study results therefore provided cues for improving the questionnaire, defining more detailed research questions, and most importantly, sparked interest in us. Would there be a difference between the musically active and inactive medical doctors? What are the inclinations towards music interventions that are present in the average Slovene physician?
So the next step was to study a bigger sample of Slovenian musically active as well as inactive medical doctors, as Mansa already mentioned. We were interested in the differences between the two groups among the standpoints towards music integration in the Slovenian healthcare system. Furthermore, we wanted to explore their standpoints and knowledge about the benefits and limitations of the use of music in medicine and identify the areas of work where music could most easily step into the picture. We distributed the questionnaire among personal contacts and physicians showing interest in our pilot study with the request for them to share the questionnaire with their personal contacts. While a fair interest was shown in our research, we were not able to gather enough responses in a limited amount of time. In fact, we were only able to get 3 complete responses in 1 month. However, we believe that the lack of responses also shows the result on its own. We believe one of the reasons for the low response rates to our questionnaire is the aim to gather opinions through the questionnaire itself, as well as the timing of the study, namely seeking Slovenian physicians' opinion on acceptability and feasibility of music interventions by a questionnaire during the summer holiday time, as well as during the 2nd year of the pandemic, may not produce a high response rate since the medical staff is overburdened and exhausted. These concerns led us to question of whether such a public opinion study in the healthcare system can provide us with valuable data to plan further steps in the desired introduction of music interventions, even in case of a high response rate. There may be better ways to attain this goal. Implementing music interventions into healthcare requires specific skills and quite a number of favorable circumstances in terms of theoretical and clinical knowledge, as well as novel interdisciplinary teamwork to succeed. Anonymous public opinion data may thus not serve this goal. So a failure, in example, being unable to say what the large medical body in Slovenia may think, whether they would accept or refuse medical interventions and why, is after all probably not a very bad thing at this time.
Thank you, Anna. I think it's really too early for any conclusions to be made about the readiness of the Slovenian medical system to accept musical interventions. Inter arma silent muse, during the period of high tension, which the pandemic is one of the examples, certainly the arts remain silent. But there are good things to build upon. To repeat, numerous musically well-trained and motivated medical students and physicians and other health workers. Research that already has started in Slovenia, combining medical, psychological, which is very important, and musical knowledge, including this symposium. And there are a few young psychologists with good level of musical education studying in various departments of psychology in Slovenia and abroad. So I think there is a way. By setting up a task force for education and research in the field and promoting clinical activities most likely to be effective, I assume we may be at the beginning of a good story, hopefully also with your support. Thank you.